Madoda Sambatha, MEC Health Northwest. The hospital we are at, it's Ferncrest. It's a private hospital, net care. It's a hospital with a joint operational arrangement with Department of Health and net care on the basis of taking patients who are to be operated, anything that has to do with cardiovascular operations. What had happened here is that a patient who had been in two public hospitals, Brett's first, then transferred to JST, Job Shimangani Tabane Hospital, Rustenburg, had to come here on the basis of that agreement we had for operation. Everything was done. The patient was tested in Brett's, results out, tested in JST, results out, came here. Procedurally, they too had to test the person. But because it was urgent to take the patient to theatre for operation, they had to take the patient to theatre for operation. But at that time, they were treating the patient all over, even in the public hospitals, as a COVID-19 patient for precautionary reasons.
Yeah.
Operation done, finished. When the operation was done and finished, because the treating doctor is the doctor from the public side, the one who treated the patient in JST, because of his knowledge of the results of Brett's, he decided then to lower precautionary measures because the results for the hospital were not yet out. When this patient then went to a lower level ward, which means in terms of the PPE, not everything would have been COVID-19 positive patient on availability. The patient then had to have contact with nurses and cleaners and other patients. It is 8 cleaners, it is 13, 15 nurses, 3 doctors and 4 patients. All those became the contacts of this patient, because later when results came that were done before taking him to theatre, they confirmed the patient to be positive. Where he was, there was exposure on the basis of lowered approach on PPE and handling the patient. That's where everybody was exposed. The 15 nurses, 8 cleaners, 3 doctors and 4 patients. Immediately after that, all those that were contacts were treated like contact tracing. All of them, those that had possibility of self-quarantine were forced to self-quarantine. All those that had no possibility of self-quarantine were taken to a quarantine to be paid and taken responsibility for by Ferncrest as net care. That was done. 28 went for self-quarantine. 9 had to go to paid quarantine in this instance. All of them had to be subjected to counseling, screening, and then testing. When they were tested, all of them, only 2 nurses tested positive. Those nurses that tested positive were then treated as positive cases, but in all of them, nobody is symptomatic. This also includes the doctor who was treating this patient, was also tested, and he too tested negative, not positive. So in this instance, these 2 nurses were on the basis of the exposure to this doctor. It is not because there was no PPE. It is because of the level on different PPE used at different areas.
Why was that? Why was it leveled? Why was it lowered when there's a patient during this pandemic that is coming in? Isn't every patient supposed to be treated as a positive patient?
every patient has to be treated as a positive patient. In this instance, an action was taken against the doctor who decided to lower the guard. An action was taken against that doctor. It's a matter that the Department of Health and Netcare Group are handling separate of lowering. And in that instance, we have a general understanding, even with that doctor, but that should have never been done. The doctor admits on that. Separate process we are handling, and that then exposed these nurses in this instance.
When did this happen? When did the test come back positive?
Remember, this is the patient. The patient we're talking of is the patient who is the one who's declared dead. This is the patient who later died in the province. This is the same patient.
So when did his results come back?
Okay.
Yeah.
What happened is that he was admitted here on the 2nd. And then they took tests. His test came back on the 3rd here. Before that, tests of breaths were out and tests of JST were out. So the doctor then said, on the basis of what I know as the results out, this patient could not be a risk because of that. Yet there were pending results which were taken here in this instance. This is what we are closing in that process. So this is something that would have arisen out of a decision or a mistaken decision taken by a doctor who was responsible for the patient. Because if there was never an element of deciding to lower the level, everybody would have handled this patient as a confirmed case until the patient was out. In that instance, it would have protected exposure to the nurses and everybody who was exposed. The issue is, like I'm saying, it's not non-availability of PPE. It is the type of the PPE that would be used to a ward with lower the requirement that would expose them. That's what had happened.
Have the contacts with the team nurses been traced as yet?
Everybody else has been traced. The primary contacts, nurses, cleaners, and doctors. And their families have been traced, all of them. What is also good about the response of the hospital, as they check everybody on a daily basis, they have a family briefing on a daily basis. We had checked your child who's our nurse. This is the state at which she or he is at, so that families themselves are clearer of the development of their family members in this exposure. So both families and primary contacts tested, everything done. As we speak now, the next test that is going to be done, it's a test to have them out of quarantine, graduating, but still, it's still only these two. And everybody, including the two, appears to have no symptoms. What is critical is health care workers should never be exposed. Either by procedural matters, healthcare workers must not be exposed. Either by non-availability of PPE, health workers must never be exposed. In actual fact, PPE availability must be what each facility in the province deals with to quicker, both private and public, because we will not have a situation where we have health workers in quarantine and consequentially we are approaching a surge. Who is going to be available if health workers had to be on quarantine because of exposure. Anyone who takes a decision in the line should take safety and precautionary measures, never to expose health workers to any risk, because we need them for each person who comes to a facility.
Let's go back to the doctor. You're saying a separate procedure is happening between Ferncrest and the Department of Health. What type of procedure is happening? Is it suspended? What kind of process is underway? And secondly, okay, I forgot the second one out.
The doctor is the only specialist responsible for cardiovascular problems. In this instance, what was first done was to, as a contact person himself, was to first deal with that primary process of treating him as a contact, subjecting him to everything that a contact is subjected to. The person is negative, the doctor, no symptoms. What we are expecting is that post 14 days he comes back to work. But a separate process was on the basis of whether he knew of the procedural matters on handling this issue. Whether he knew, so that he confirms that yes, there are standard operation procedures, yes I knew, yes I did this, yes it's me who had lowered the level on the basis of this. So that then he confirms it, he has confirmed. He confirms to be knowing the procedural matters. He confirmed to be the one who lowered, and confirms the reasons, like I said, of knowing the previous test results. Then we are going to the next level, post this process, on how then we deal with matters administrative of this doctor who had taken this decision. But as we stand for now, he is part of the contacts, recovering, he had never been seen, and he's going to come back post the last test results.
When you say that he had lowered the level of PPE, paint me a picture. So there are certain wards or certain places in the hospital that require high PPE. Those lowered ones, what do you mean? They only wear masks, they don't wear gloves. Like, what do you mean? What was the situation of these nurses that made them now be exposed and infected?
The situation is such that if you are admitting a person who is a person under investigation or who has symptoms, the prescription in the province and everywhere is that everyone, first EMS personnel, must have PPE that assumes that the person is a confirmed case, so that they are safe. On arrival, even the way the person is going to arrive, he's going to arrive at a separate entrance, that everybody who's then accepting that patient must have PPE that assumes that the patient is COVID-19 positive. A ward the person goes to must have everybody with PPE that assumes that the person is COVID-19 positive, including going to theater and everything. Now back to theater, that person must go to an isolation ward, that everyone must use the PPE that assumes that the person is COVID-19 positive. The difference is not every ward uses COVID-19 positive people PPE. Not every ward in a hospital. There are wards in a hospital where it's not necessarily a ward for COVID-19 people, which means if you are shifted from a ward prescribed as COVID-19 positive ward, once you are shifted from that and you are put to another ward, The PPE, it's no longer the one that is used for COVID-19 positive patients. In actual fact, your gloves would not be the same. Secondly, your mask would not be the same. Thirdly, everything that you wear, even your attire, it's not going to be the same. That's where exposure now comes, because in that ward necessarily, positive people do not get admitted in. In this case, a positive patient was removed from a COVID-19 ward and sent to a ward of a person who's not COVID-19 positive. This is where exposure comes in.
So that's where the blunder happens.
Because in a COVID-19 ward, even people who get in are limited. And secondly, they are not allowed to go home. Arrangements are made for their separate accommodation so that they do not then transfer that to their persons. In actual fact, this incident, we've just discussed in now possibility of having a hotel type accommodation where healthcare workers who are exposed to many patients could take a decision not to go home, but to go and stay there. It's there and work, and they will only go home under circumstances defined by them, so that we lower the element of exposure to families and exposure to bigger groups by healthcare workers who are in actual fact in the front line of the response. This we want to do precautionary, so that there's available accommodation we have, and we know you are going to come to work and go to that place, come to work and go to that place. Then the issue of seeing your family should be on the basis of a high level of precaution, so that you don't have situations of where, when you are exposed at work, you easily take your exposure home.
What message do you have for other doctors, other specialists, like the one that you're talking about, who will possibly in future do such a deadly blunder like the one that did here now? What message do you have for health professional specialists that are gonna be treating different patients going forward to avoid such a blunder?
Healthcare delivery on its own, it's a risky work. We must first appreciate that we have South Africans and non-South Africans whose commitment is to remain in the field irrespective of the risk that the field possesses. Second, we must then call on everyone, including management, everyone in health, that precautionary measures should always conform with the requirements of handling persons under investigation, or with the requirements of handling persons who are confirmed COVID-19 positive. These precautionary arrangements are done to protect, first, healthcare delivery, secondly, healthcare workers, thirdly, protect the same patient, and fourthly, protect society, so that everyone in the line of delivery of health service does so with caution. So when a doctor decides, any doctor who decides, or any nurse who decides, or any professional, including management who decides, must decide on the basis of precautionary measures. Should never be allowed that our decisions have risk to any other person.